Since I had to leave right before the instructor checkoff, I kind of just wanted to make a video of my understanding of an Ionto treatment, just in case I'm wrong. It opens up the conversation for that. So I would start by grabbing my vial and then whatever size electrode I would need. And I would determine the amount of medication I use by the size of electrode, because the bigger the electrode, the more it's going to hold. While that's just kind of sitting and soaking into the pad, I would want to turn on my machine, make sure that it's set to the correct channel that my wires are connected to. I would then choose my dosage. In class, I believe the numbers were, you can choose between 40 to 80, but 80 has been shown to be more effective. I would then want to put the electrodes onto the patient. The active one is going to go over the problem area, and then the dispersive one, it can go either proximal or distal. You just want to have it at least an electrode size away from the active one. You would then set up your clips to it. The black one is negative, the red one is positive, and you would want to clip it the same as whatever the polarity of the medication is. So like we're talking about the dexamethasone, I believe that's what it's called. That is a negative charge, so that you would want to put the black clip with that so that it could repel each other. Once everything is attached, you would want to let your patient know what it's going to feel like before you start to run it. So you could tell them that it could be a little prickling sensation. It could feel like pokes, tingling. It should not be an intense burning sensation. It should not hurt. It may be uncomfortable though. So I would set the toggle to run, turn up the intensity. You would first want to ask your patient when they feel it, and then you would want to keep turning it up until they can tolerate it. These machines go till 4, so setting the parameters on these are a little bit different, because once you set your intensity, the time is set for you. So a lot of patients will max out their intensity just so that the treatment time can be shorter, but if someone couldn't take that intensity, you could just lower that down, but that would just add on to the treatment time. Once the treatment is done, you would want to zero everything out before turning off the machine. You would then want to take off their electrodes, and they get very sticky, so it's kind of like taking off a Band-Aid, so you would maybe want to warn your patient about that before you just rip it off. The skin will be red more than likely. It's very common to get little blisters on the hair follicles, so if you see that, that would be completely normal reaction, and you would want to let your patient know that, and then afterwards you would be good to go.